We've been doing a lot of work provincially together with the mental health services planning and trying to really think about our whole province of children and youth and how do we help our communities to deliver evidence-based care so that a youth, no matter where they are, will be receiving excellent care and getting the help they need. I mean, I think it is all about access, and sometimes we think about access as wait lists, but we also know there are a lot of youth that need our services that never knock on the door, so to speak.
We really recognize there's a tremendous amount of expertise in our community, and that there's a recognition within our mental health and addiction services that we need to work in partnership with our community experts to really optimize how we can plan care to match the right level of need for patients and families. And Homebridge is a really great example of a partnership whereby we have a very high-risk group of children and adolescents that have a wraparound service through Homebridge Society, which supports housing, residential housing and services for at-risk youth that are in the temporary or full-time custody of the Department of Community Services.
Homebridge meets young people where they're at. The young people are living in their facilities, and they have a remarkable way of being with young people throughout their emotional dysregulation, throughout their trauma, throughout their pain. They're in their day-to-day lives in a very meaningful way. Sometimes attending an appointment can seem very artificial compared to that.
The IWK loaning us their clinician, loaning us their expertise, coming through the doors with that capacity is amazing, but the real mastery is how Jeff translates that into a daily life event meeting with a young person so that they don't even know they're meeting with a clinician. They're meeting with Jeff, and that is the mastery.
Putting families first and trying to think of what their experience has been a big thing that we've been really working on in this past year, and really going from the family's lens of what is really helpful to them. And that has been probably the biggest help to us in really leaning our processes out and figuring out what are the things we're doing that are actually being helpful and what are the things we're doing that might not be needed and might not be adding to the patient experience. And in that, finding efficiencies where we can improve access, improve actual outcomes by engaging the family in a meaningful way. I would say we've really streamlined that in terms of knowing the family's engagement in a real way from the very beginning.
One of the huge strengths of the IWK is the teamwork. Everywhere from like my family doctor to like a psychologist to a psychiatrist to the person who would assess them. If you go to another person, when you get there, they've already been briefed on your child and the pluses and the minuses, but the transition was seamless.
Over the past year, we've put a concerted effort on looking at access to patient care, and so through LEAN initiatives, our program has worked very closely with the staff to understand how we can improve access to care, to look at a number of quality improvement initiatives from clinical and operational to actually look at ways to find efficiencies in our system to ensure that we have a quicker access for patient care.